Hello, this is Jennifer Martin. Thank you for watching my capstone project presentation. My proposal for practice change is to replace the Clinical Institute Withdrawal Assessment of Alcohol Scale, revised, or CWA-AR, with the Modified Minnesota Detoxification Scale, or M-MINDS, for detection of alcohol withdrawal syndrome in critical care units. Current assessment of patients experiencing alcohol withdrawal in critical care units utilizes CWA-AR, delirium detection scores, Richmond Agitation Sedation Scale, Riker Agitation Scale, confusion assessment method for the ICU. The problem with this is none of these assessment tools have been validated for use in the critical care setting to detect alcohol withdrawal. While the MINDS alcohol withdrawal scale is also not validated, it was designed specifically for patients in the critical care setting who may be experiencing alcohol withdrawal. This proposed practice change is significant because often due to intubation, head injury, confusion, or sedation, patients admitted to critical care settings are unable to answer questions outlined on standardized medical protocols such as CWA-AR. And treating the patient appropriately for their condition can not only reduce the length of stay in the ICU setting, but can also prevent life-threatening symptoms. Leadership concepts I chose to use for this project were trust and emotional intelligence. Kowalski writes, "Trust is probably the most delicate aspect within relationships and is influenced far more by actions than words. Emotional intelligence is characterized by social skills, interpersonal competence, psychological maturity, and emotional awareness that help people harmonize to increase their value in the workplace." This is according to Blake and Kist. The goal of the proposed practice change is to improve the assessment of intubated ICU patients experiencing alcohol withdrawal syndrome in order to decrease adverse complications by preventing delays in the detection of alcohol withdrawal syndrome, which impedes treatment. The outcome of the change in practice would be detecting alcohol withdrawal syndrome sooner and would hope to improve patient outcomes, reduce prolonged hospital stays, and prevent injury or even death. This change could impact healthcare policy by confirming evidence that the M-MINDS tool used in critical care settings prevents prolonged stays and complication while improving patient outcomes, thereby reducing healthcare costs. It could also serve to validate research encouraging more institutions to change their current assessment practices. Healthcare consumers would likely benefit from this change because shorter hospital admissions without complication reduce personal costs, but also prevent harm and improve health status. Leadership knowledge and skills I hope to gain from this project, as I mentioned, are building trust and refining my emotional intelligence. Developing trust with colleagues is vital to the success of the project and demands clear communication, collaboration with team members, and leadership by example. A good leader also accepts feedback, criticism, and critique. Using emotional intelligence, a leader will be able to manage emotions in a healthy manner, not taking criticism personally, instead using it to grow. Action steps to initiate changes would be to involve the leadership and management teams, present the modified minds to staff prior to the implementation of the change through huddles as well as emails to alert the staff of coming changes, timeline, and the expectations. An educational poster would be created and posted in the unit. Checking in frequently with colleagues during this transition to monitor progress and address concerns, and making the MINDS assessment easily available for staff to use during assessment and send a survey at the end of the trial period. Resources I identified for this project were leadership and management, colleagues, information technology, and the informatics team. Barriers to the success of achieving my goal and implementing the change could be staff unwillingness and resistance. Another barrier could be increased workload on an already busy staff, which may limit the success of this project. Just a brief overview of alcohol withdrawal syndrome. Signs and symptoms are defined as mild, moderate, or severe. Mild symptoms include tremors, anxiety, diaphoresis, tachycardia, sleep disturbances within 24 hours of the last drink. Moderate to severe symptoms are fever, confusion, clouding of sensorium, hallucinations, and seizures. The most severe complication is delirium tremens. This occurs within 2 to 5 days after the last alcoholic drink. Symptoms include fluctuating levels of consciousness, cognitive and attention deficits, hallucinations, confusion, and hypertension. If DTs are not managed, this can lead to cardiovascular and respiratory collapse, arrhythmias, dehydration, electrolyte derangements, and multi-organ dysfunction. The mortality rate is 5 to 15%. DTs may occur within 5 to 20% of patients with alcohol withdrawal syndrome. Communication of the project would be done in poster format, outlining the difference between CEWA-AR and the modified MINDS tool, as you see. This poster was adapted from the Journal of Critical Care from July 2018 issue. CEWA-AR scores patients using 10 parameters, which include nausea and vomiting, tremors, anxiety, agitation, paroxysmal sweats, orientation and clouding of sensorium, headache, tactile disturbances, auditory disturbances, and visual disturbances. 5 of these parameters require the patient to verbalize their symptoms to the clinician. With the modified MINDS score, patients are scored using 8 parameters. The parameters are tremors, agitation, paroxysmal sweats, orientation, seizures, pulse, diastolic blood pressure, and hallucination. If the patient is intubated, a score of 0 is given for symptoms requiring verbalization. To monitor progress, daily check-ins would be conducted to address concerns and give feedback from nurses. At the end of the trial period, a survey would be sent to all staff to determine efficacy of the MINDS tool as compared with the CEWA-AR, as perceived by the nursing staff, and it would ask how they feel it impacts patient outcomes. Another evaluation tool to monitor progress of the initial goal would be to involve informatics to compare lengths of stay, infectious complications, delirium, and the need for mechanical ventilation in patients diagnosed with AWS, assessed with CEWA-AR as opposed to the MINDS tool. Depending on the reason for critical care admission, treatment protocols vary for alcohol withdrawal and will impact these numbers. For example, a patient with a head injury requiring hourly neurological examinations may not receive adequate benzodiazepine therapy to prevent symptoms of alcohol withdrawal, despite the use of the modified MINDS tool to identify active withdrawal. This could be another policy to examine later to ensure safety and better outcomes. The expected outcome would be a reduction in length of stay for patients experiencing AWS in critical care and prevention of complications. If nurses were resistant to the change, I would actively engage these nurses in professional discourse about their reservations and try to alleviate concerns and increase open-mindedness. Working with nurses and discussing the best way to implement the assessment into the workflow may better help to integrate this tool. Unexpected outcomes for this proposal would be that no patients admitted during the time frame allotted had experienced alcohol withdrawal. If this were the case, the timeline for trial may need to be extended. The implication for future healthcare policy could be implementing a research study to validate the modified MINDS tool as evidence-based practice in the critical care setting. By validating the tool for this population of patients, delayed care, preventable complications, and even death could be avoided. Implementing this change could also reduce healthcare costs for the consumer as well as the hospital by reducing lengths of stay and complications. Finally, I would like to thank you for watching and wish you all the best in your endeavors.